There's so many opportunities here at Hammond-Henry. It's a small hospital, so you can take on a variety of roles. There's so many different things that you can do every day.
I lived in Cambridge in a small town, so this is where I came for all my care. Also, it being so close to home, we're just a close-knit family here. When we work together, we're just like family.
I have been a patient in this hospital. My kids have been patients in this hospital, and just the care that they deliver here, I knew that I wanted to be a part of that.
I love my job. I chose Hammond-Henry because I worked here once as an agency nurse, and I just felt this amazing sense of acceptance, and I just knew that this small community hospital was where I inevitably wanted to be.
The nurses tend to have a little bit more time to spend with their patients rather than at a bigger institution. Also, being in a rural healthcare setting, it's hard sometimes for people to be able to get to the bigger facility, so it's nice that our small community hospital is able to offer some of these services that a bigger hospital would be able to provide.
The community aspect of this hospital is really something beautiful to be aware of. Being here at Hammond-Henry, the small town, the small knit group, it really does emphasis on the family aspect of things in the small community.
I enjoy working at the rural setting. I have a close relationship with providers, nursing, people from all different departments, radiology, dietary, environmental services.
You see people and you feel like you're appreciated more being in such a rural community versus a bigger hospital.
A lot of places I've worked at, I may have worked there 5-10 years, and you see people walking down the hallway. You recognize their face, but you didn't necessarily know their name. Within my first week of working here, people were calling me by name, walking down the hallway, and that was a big deal for me.
It's a great place to start. The resources that you need are here, and I continued my education to register nurse, and I have not yet thought of continuing, but if I did think about it, Hammond-Henry would help me.
I love coming to work every day. I don't have any issues getting up in the morning and knowing that this is where I'm going. I love being here. We have a very small unit down there. It definitely helps us have that family kind of feeling.
Making people's day better. I like to send people out of here feeling a little bit better than when they came, especially if they are having a bad day or a tough diagnosis. The teamwork is phenomenal. I have not seen that everywhere that I've been. We're just a great team.
You get to feel like you're making a little bit of difference in their experience. If they're anxious about their procedure, you have that time to make them feel comfortable, take care of them, and often we get some really tremendous feedback from our patients about that experience they have and how they feel like they were well taken care of, like they were part of our family.
And I really, really enjoy taking care of people and helping my community. I've been in healthcare since I was 15. Never really wanted to do anything else. It's very rewarding.
See who's on, and I see how their day is, and then I'll make my rounds with the patients, and it's something that I love, going around and making everybody's day just maybe a little bit better, just taking a little bit of stress off them.
I love interacting with patients. I like developing long-term relationships with them, getting to know them and their medical needs, their family.
People know you. People know your family. They know where you're from. They care about you. They understand things that might come up in your life. At somewhere bigger, you're a number.
It's really hard to describe because it's so unique, because we're rural health and we have a med surg, we have surgery, we have an ER, we just have everything right here. We're a team, we're small, you know everyone. You walk down the hall and even though they're part of IT, you know their name. Hi, good morning, Heather, how are ya?
Everything about our day, you know everybody in every department, and you truly have a family environment here at a smaller critical access hospital, and are able to provide even more well-rounded care because we have a lot more touch points to patients than you would at a large organization.
This is the place to come. The bigger institutions may have all the technology, may have a lot of different staff around, but our hospital encourages and allows you to get that closer feel, closer care. You get to know the families of these people. They are not a patient, they are a family.